Welcome back. Local waterways are filled with people during the summertime. It's a great way to enjoy the Gulf Coast and also cool off, but the water can be dangerous at times as well. So we want to warn you about one of those dangers of vibriosis. It's a naturally occurring bacteria that can be found in warm and brackish waters. Joining us today now is Dr. Bokhari from USA Health to talk more about Vibrio and what you need to look out for. Thank you so much for coming in today.
Thank you so much for having me. It's a pleasure to be here. I'm an infectious disease specialist at the University of South Alabama. And the vibriosis, we have about 4 to 5 cases of vibriosis here in the health department. And I think it's very important to let people know what to look out for, who is at higher risk, and who needs to be more mindful.
Well, before we go into that, I do want to talk about the trends because I've noticed we've not yet talked about Vibrio. Are you seeing more cases now to warrant this conversation?
Well, 5 cases and 3 of them are Vibrio vulnificus cases are enough for us to be concerned. It's very hot, it's above 100 degrees, which is where the Vibrio bacterium gets really high in the waters. So the question starts with, what is Vibrio infection? It's a gram-negative bacteria that can cause either wound infection in patients who have low immunity, and it can go from simple cellulitis to the flesh-eating bacterium, which is necrotizing fasciitis. So people need to be aware of this.
So we talked a little bit about who's at risk. As if you have an open cut anywhere on the skin?
Anywhere on the skin, if you're swimming in the waters, how do you get it? You get it either from wading in the water, exposure of water. So we have Vibrio in our waters. But in the summer months, when the temperatures get higher, the inoculum of the bacteria gets so high that the chances of getting infected are higher. Now, who's at more risk? Patients who have poor immunity, like diabetics, and we have a ton of diabetics in our community, HIV patients, cancer patients, patients who are on chemotherapy, immune modulators, chronic renal disease, chronic lung disease, like patients with cirrhosis, hemochromatosis, thalassemia. So this kind of boils down to a lot of people, and they need to be mindful if they are, and also if they're eating raw shellfish like oysters. So we all love oysters, but the problem is that if you have any of these conditions, your chances of getting gram-negative septicemia and bacteremia and really bad infections is high. Kind of a ballpark, CDC estimates 80,000 cases of Vibrio infection in the US annually, and 52,000 of those are by Vibrio parahemolyticus, which is more like a mild diarrheal illness. You will have nausea, vomiting, abdominal cramping, and patient is fine in 3 days without any antibiotics, but the patients who are immunocompromised may need to be hospitalized. But Vibrio vulnificus is the one we are most worried about. If you have any sores, diabetic people have diabetic feet. If you have claudication, you have sores, that wound will get red, indurated, there will be blisters, pustules.
And really quickly, before we run out of time, because we've got 20 seconds, how can they avoid it?
Do not go in the brackish waters, which is seawater. Avoid eating raw shellfish. And if you see any symptoms, please present to the urgent care or the ER immediately. Tell them about your exposure so they can be started on a combination of antibiotics. One wouldn't work. You need at least 2 different classes of antibiotics to be started.
Fantastic. I wish we had more time to talk about this, but you did cover the treatment.